There it is, recording on this computer. Good afternoon, Tuesday, July 12th, live with Jane and Jody. It's great to see everybody. Yes, I am recording. Please do turn on your cameras. Feel free to engage with us as we have a fun conversation today. Today, our topic, we actually have double topics. We're going to go over some physical medicine as well as minor surgery. So, all right, real quick intros. For those that don't know who I am, my name is Jane Voorhees. I'm one of our admissions representatives here. So helping candidates get ready for a successful interview, prepare to join our naturopathic doctorate program here at SCNM. I've been a part of this program really in the admissions role for about 9 years off and on. Like I took a little sabbatical and I was off in another career for a minute. So, but for sure, my heart is here. I love naturopathic medicine and it's super exciting to be a part of your journey and help you guys along this way as well. That's all I can think of about me. So I've been in Arizona for 20 years. I love it out here. All right, that's enough about me. Jody, please say hello.
All right, good afternoon, everybody. My name is Jody, and so I work very closely with Jane. I actually work with the beginning of the alphabet where she works with the end of the alphabet, but we do the same thing. Our goal is to get you guys started into this program and be part of this incredible journey. I'm originally from South Bend, Indiana, moved out here in June, was 20 years. So been out here 20 years ago. It's nice and toasty out here at this time of the year, but it's okay. It's all right. Our winters definitely make up for that toasty time of the year. I've actually been with SCNM in August, will be my 16th year. So I've seen a lot of students come through the program, a lot of alumni. Absolutely love what I do. I love this community. I love everyone I work with. So it is definitely rewarding to Jane and I to see all of you go through this program is rewarding to us as it is to you. So welcome, and we'll get started here shortly. 2 modalities today. Incredible. I usually share a core value with everybody. Core values, of course, are beliefs of our institution. So today I chose we achieve excellence. Here at SCNM, we are always constantly striving for excellence and are always looking to improve our curriculum, our teaching method, as well as do whatever we can to improve our community that we live in. So, excellence. Can't hear you, Jane. Jane, you're on mute.
Sorry, my screen resized and I couldn't quite get to the mute button. Thank you for that excellent core value, Jody. I believe that we are achieving excellence here at SCNM every day. I think that's a great choice.
Absolutely.
To start us off. Thanks to these incredible doctors that we have joining us today. That's how we are achieving excellence. So we're going to share with you guys, I'm going to tell a little bit about both of the doctors that are joining us, and then together we're just going to do our usual. We're going to throw out a couple questions, softballs, and then we really want your participation and join us. We get the awkwardness of Zoom. So maybe let's try using those raise your hand things. Like those are fun, right? Let's try that. We haven't done that much. But of course, the chat too, right? Put some messages or questions in the chat. All right, so let me go with Dr. Calvin Kwan is joining us. He's a naturopathic doctor, grew up in California. He's a graduate of Bastyr University, has a sciences focus in undergraduate, and that's all right, Bastyr is a great sisters school out there. I see you did a residency in Washington. I'm just curious, quick sidebar. Did you go to Bastyr Seattle or Bastyr San Diego?
Went to Bastyr Kenmore, but yeah, I did my residency there.
At Bastyr up in Washington, gotcha. And so Dr. Kwan is currently the supervising physician for the Neil Riordan Center for Regenerative Medicine here. So we're going to learn a lot about what you as students will be learning through that. Outside of SCNM, he's got some fun hobbies of pickleball and rock climbing, which I'm sure there's some good advantages of that. Right here, Camelback Mountain. That's probably an easy one for you. All right. Also joining us is Dr. Rodriguez, a naturopathic doctor who's a graduate of SDM. She is an Arizona native, got her degree right here at ASU. Also did some additional post studies, it sounds like, preceptorship in dermatology. So we're going to focus on minor surgery today, which is going to be a local, I'm going to learn all about it. I'm excited. I actually had some once, so curious to learn more. Currently an assistant professor at SCNM, teaching dermatology and minor surgery. Outside of the SCNM, full-time wife and mom, 3 boys, I cannot imagine. And your husband is he's the chef, which is great. Let's get spoiled. So it's great to meet you both. Dr. Kwan, would you like to do any additional intro? Please, by all means, take the mic.
Just one quick one. I do supervise the student club, the Integrative Pain Management Club. So if you're all ever, interested in that kind of stuff, we give you some hands-on experience. And I have a pretty extensive history in working with professional athletes and just athletes in general. And so I think it's just a good experience for you all to see that and really gain extra experience when being a physician. And can't really say that I'm as excellent as Dr. Rodriguez, though. Just...
Please, Dr. Rodriguez, please, any additional intro?
Not really. You basically covered it. Being full-time mom keeps me pretty busy, as well as being an assistant professor. I also have 2 student rotations at the medical center that are primarily dermatology and minor surgery focused.
Awesome. Awesome. So let's just dig in here. I know Dr. Rodriguez is needing to leave a little bit early. So hopefully what we'll do is we'll just go back and forth. And audience, please, throw in your questions there, raise your hand. We just have some canned questions just to get everybody started, but we've had some amazing audience participation in these. So hopefully we'll continue. So I'm going to start with Dr. Kwan. Dr. Kwan, can you tell us, how did you become interested in naturopathic medicine to begin with?
I guess most of y'all, you're kind of just sick of the system. When I was in pre-med in college, I had a very awesome opportunity to volunteer at a hospital. And in that volunteer capacity, I was able to even go into surgical rooms and all these things. And I remember distinctly in a specific surgery, a total knee replacement. And I remember watching the surgeon climb up this ladder and just like using a mallet and hammering in, a knee replacement, just a whole prosthetic, right? And so I was like, wow, at that moment in time, I just had this epiphany. It's like, what could we have done to prevent this patient from being here in the first place? And so I think that started the whole downward spiral or upward spiral. Let's just say upward spiral of where I am now. So, you just start noticing things. I think a lot of us become a physician because we are empathetic. And so, just trying to be good humans, right? And so I think we all try to do the right thing. And I think you guys are in a really challenging space right now, but at the same time, it's very fulfilling. So, yeah.
Very good. Thank you. Dr. Rodriguez, same question. What about you?
So I found my way to naturopathic medicine. I had been preparing to go to allopathic medical school and studying for the MCAT and working as a social worker. And I, as part of my social work, I was assigned to a family with a 4-year-old little boy that was diagnosed with bipolar, which at 4 years old is a really early time to make that diagnosis. But he had started being medicated and ended up in the hospital due to liver failure. And I was just so devastated for him and for the family. And I just was like, I don't want to be a part of the system that, can put a 4-year-old into liver failure based on, overprescribing medication. So I really got interested in looking at other routes of medicine and other routes of being able to help people. And it was actually Dr. Bethel, who is an anesthesiologist that works at the Neil Riordan Center, who was my mentor at the time and mentioned naturopathic medicine to me, and I'd never heard of it. But as soon as I kind of looked into it a little bit more, it just really spoke to me of taking a holistic approach to healing and healing the whole person instead of compartmentalizing people.
Wow.
That's so cool to learn. You knew Dr. Bethel before SCNM. That's pretty neat, right? Oh, neat, neat.
Oh,
I had a question for Dr. Kwan too, but I'm going to go back to the canned questions. I'm off track. So let's go more specific to like, all right, physical medicine. Dr. Kwan, what specifically took you down the road of physical medicine? You mentioned earlier, oh, that's what it was. Athletes and stuff. Like, yeah, let's go down that road a little bit deeper.
Excuse me, sorry. I actually wasn't really into phys med until I met my mentor. And so I was actually more into cardiovascular diabetes. And you know, you never plan for these things, right? I never planned to teach, and I am, so it's kind of crazy, right? So never, just always keep your doors open for possibilities. But I met my mentor. My mentor worked with the Texas Rangers, worked with the Mariners. You know, he just worked with so many things, and he's like a ND, LAC, PhD, like a MS, and I think he was working on his MD as well. So he's a freaking badass in my eyes, and he's just a genius, right? And so, you know, I took his courses, and I was just, you know, I just knew that I really want to work with my hands, and having the capacity to use your hands to, you know, heal people. That's amazing. There's just no other thing you can do that you can provide instantaneous relief for patients. You know, it's not like watching someone take diabetic medications or making lifestyle changes. That takes months to years to who knows how long. And so it's pretty gratifying. Maybe I'm a millennial in that way, and that like that instant gratification. But you know, I think that's the biggest piece. Is just I love the hands-on. I love the interaction with my patients, and just that, you know, capacity to heal someone around the spot.
If I was actually closer to the campus, I'm sure I'd be there all the time for manipulation. I love my chiropractor. I
Oh,
do.
yeah.
Like, that is one of my primary go-tos if I'm achy for any particular reason. All right, I was going to ask the same question, but hang on, I got a question in the chat. Dr. Kwan, you completed your studies in residency at Bastyr. What specifics of SDM Institute allowed you to bring your practice to Arizona? Thanks for asking, Nikita.
What specifics? Well, life brought me here. I wasn't really planning on working at SCNM. It just happened, right? So it's just life. I wish I had a better answer, but I think my life, in my life, I think education is always going to be a piece of it. So there's no better place to go. In fact, I believe that you guys are in the best school right now. I'm not going to lie. I know I work here, but they paid me to say this. No, but you guys are provided so much opportunity here, and the growth and the speed of growth here is phenomenal. And you know, we don't have a regenerative injection center at Bastyr. You guys do have that here. You have the capacity to check it out, work with Dr. Bethel, and so, you know, I think the school's on the cutting edge compared to the other schools that are a little kind of left behind.
It's such great feedback and point of view for sure. Yes, thank you for sharing. So, Dr. Rodriguez, what specific your interest is? Dermatology, right? What drew you in that direction?
So when I started my journey of wanting to become a doctor, I always said that I was going to be a pediatrician, that I loved children and I wanted to be a pediatrician. And I will advise you that when you start medical school, you're going to have all these dreams of what you want to do. And as you actually get a little bit of experience in it and you try it out, you're going to say, this is not for me. And so first it was pediatrics, and then it was oncology, and oncology was, you know, I didn't like giving people bad news and watching people die. And suddenly quarter 10, quarter 10, we had our first minor surgery class with who at the time was Dr. Kiefer teaching that course. And she was just so inspiring. And the first time I got to cut into a pig, I thought, you know what, I like cutting into things. And I became really passionate about dermatology. And one of the main reasons that people come to the doctor is like, I've got this. What is this? And I appreciated I need to know what it is in that moment and know what to do about it. Also kind of like the quickness, instant gratification of it, and the fact that it draws a lot of people in, and people are concerned about things that suddenly appear on their skin. And I like being able to help them. And also the connection of the skin to the entire body. So much of our health is reflected on our skin, that it also gives me the opportunity to, well, you have acne, so let's talk about what else is going on with you. Is it a hormonal issue? Is it a stress issue? Is it a dietary nutrition issue? Let's figure out what's going on with you as a whole person so that we can help heal your skin.
Very good. Very good.
Thanks.
So let's talk about in the physical medicine realm and the minor surgery. Let's talk a little bit about what are the different treatments or the different therapies that fall under minor surgery or fall under physical medicine. You want to start, Dr. Kwan?
Well, the cool thing is, I would say I'm younger than my predecessors, and so a lot of the modalities that we bring in now are more updated, and we aren't using antiquated techniques anymore, or I prefer not to, because I am the chair of the phys med department here, so I'm trying to upgrade this institution to utilize more modern techniques. And so we do a lot of therapeutics that you might see, like cupping, scraping, joint manipulation. What we do at the Neil Riordan Center is regenerative injections, so joint injections and things like that. Yeah. Is that
okay? So we're going to come back to talking about cupping and like prolotherapy. I'd like to hear more about that. But okay, Dr. Rodriguez, what about you? What types of treatment fall under minor surgery, or what do you normally see?
Yes, so dermatology and minor surgery kind of go very hand in hand. Usually if you see something growing on the skin, you have to be able to remove it. So minor surgery really falls under surgery of the skin. So biopsies, excision and removals, incision and drainage of abscesses. We do cryosurgery, which is freezing with liquid nitrogen. We can do nail removals, nail trephination, which is like when you kind of drill the little hole into the nail, if anyone has ever like slammed their finger in the door. We do toenail removals. Like I said, we do suturing. So reparation of any like traumatic lesions or lacerations. Trying to think. Also, sometimes some injections for scar therapy. Aesthetics kind of falls under the umbrella of minor surgery. It's not something that we are teaching at SCNM quite yet, but we have an aesthetics club, and it kind of falls under the umbrella of minor surgery and things that we can do. At least the safety aspect of aesthetics you'll kind of get taught during minor surgery.
Very good, very good.
I have follow-up questions, but there's some in the chat for sure. So yeah, let me go to the audience questions because I'm not a student here, but let's see what we got. All right, so Dr. Kwan, how does your expertise differ from an MD who specializes in orthopedics?
I believe we're no different, except that we just don't do surgery. I believe we're the best option for a patient for anything prior to surgery. So if the patient is saying that they have run out of options, I don't believe them. No, I don't believe them. I don't believe that's true. There's a lot that we can do, especially since we don't treat just the symptoms. We always treat the cause, and we at least dive deep into it and kind of pair it up with getting really thorough history. I think that's what's missing in our current medical world now is history sucks. The patient relations is not awesome, right? This rapport is horrible. And so how do you just treat someone based off of an MRI? And I don't think that's how it should be, because a patient's pain could be coming from something else. And the MRI, I mean, if you looked at all of your backs, you guys all probably have back issues. I know, as long as you guys look, Jesus, you guys look like babies. But you guys probably have something going on, right? But it may not coincide with what you see on the MRI, and you might not have pain right now. And so treat the cause, guys. the most important thing for me, at least. So I think that makes us better.
Very clear. Thank you for differentiating. Also, hi, Dr. Kwan. Recent news have been showing athletes dropping on the field. Given your background and experience, what treatments have worked best on athletes?
Dropping like they're passing out, or like they're just getting injuries?
Right, just passing out randomly.
Passing out randomly. I mean, that's a testament to just your preventative care, right? Like, so, you know, going to your primary, going get your well checks, your sport physicals, that's the most important, right? And so once you have a good history of your, you know, conditions and, you know, genetic testing, even I would even go that far, just check for Marfans or things with the heart. You know, a lot of people are drinking, what do you call those? Energy drinks. It's one of my vices as well. I apologize, but energy drinks. I think that's a big thing too these days. So I think it's just prevention is huge.
Yeah.
All right, so what came to mind for me, and we might be going into this later, but as you spoke, Dr. Rodriguez, you talked about your own original experience on the pig's feet and kind of what sparked for you. So I'm curious, are students today still learning on pig's feet, or are they also learning on real patients? Are you teaching both in the clinic and in the lab?
Yeah, so in the lab, it's pig's feet. Unfortunately, people don't usually volunteer to let students like cut into their skin all that often. However, once you are in clinic and you get to be on a minor surgery rotation, there are a few docs that do a couple of things, but once you're on a minor surgery rotation, then you actually get to practice on humans.
Wow. Okay.
I see that is a little bit later in the question, like we get more specifics into the credits and things like that. Jody, you're probably up next. What's your question?
All right, so let's go back to the treatments. So Dr. Kwan, you mentioned cupping. And the reason I ask is because I myself have had cupping. I myself have had prolotherapy, acupuncture, you know, all for back issues. So kind of explain how these treatments are done and what you're looking for, or what you're looking to accomplish by cupping or prolotherapy, something like that.
That's a good question. So, you know, at Bastyr, we have the option of not to take acupuncture. Here at SCNM, the cool thing is it's actually fused into your program. And so it offers you kind of a lot of options. However, because I don't have that Oriental medicine training, I treat patients, albeit the cupping technique is borrowed from Oriental medicine, but I utilize any technique that I can do to help modify the fascia, tissue, blood flow, whatever it might be of a patient. And so a lot of techniques that you guys are familiar with, like you know, soft tissue work, massage, you know, even just like pushing an elbow into someone's upper trap, right? That's a lot of compressive type techniques. And you know, if you think about it, cupping is a suction or a, you know, negative pressure type technique which lifts tissue. So we provide you know, blood flow to those areas. We cause bruising. Bruising is actually very beneficial, right? And so we lift the tissue and tear up any adhesions. And so it's just utilizing your knowledge of anatomy and seeing how you can treat a patient. Is the patient sitting all the time? Then you should probably do a technique that lifts the tissue up, right? And so that's just a piece of it. But you know, it's more like I don't know if you guys know who MacGyver is, but I try to MacGyver my way through you know, working with patients. What I'm trying to say is, you know, I try to be very creative in what I do, and because of my knowledge in anatomy, and it's the most basic knowledge, right? Like this is what you're going to be learning the first year. I refer to my anatomy and physiology so much, and so your basic education is very important, and don't discount it. And so, yeah, that's what I have to say about cupping.
I do have a follow-up, because I was trying to write it down earlier when you mentioned the different tools. You had said cupping, scraping, joint injections, and then you were like, blah, 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 and I couldn't keep up. So can you do me a favor and kind of run through, like, what are the tools that a student is included within their curriculum? What are the tools specifically under physical medicine that they're learning? Can you give me that bullet point list again?
Ooh, okay. Well, the ones you listed. We also do electrical stimulation in the sense of TENS units and or interferential. We do things like therapeutic ultrasound. We have a device here called a pulse electromagnetic field therapy. And so we utilize that technique to kind of improve blood flow and induce healing. Obviously, we have scraping techniques. We use a metal tool and kind of break down tissue to break down adhesions and such. And we have a lot of other random devices, but the injection side of things, we have at the Neil Riordan Center, what we're known for is regenerative injection. So you guys might be familiar with prolotherapy, but we do utilize dextrose as a solution that will aggravate tissue to cause localized inflammation for healing. We also use platelet-rich plasma, and we also have autologous stem cell, where we derive it from the patient's hip, and not really hip, but the ilium, and we spin it down and place them back into the patient. But obviously for younger patients, right? Our older patients will use something like a cord blood derivative of some sort of matrix. And so you have the opportunity. I don't do a lot of those injections in the sense of stem cell, but our physicians there, Dr. Trahan, Dr. Dunnings, and Dr. Bethel, all provide that training there, especially if you are in the residency program, which is very challenging as you're working with Dr. Bethel and anesthesiologist. So it's pretty badass. You got to have some grit. Got to have you got to have some grit to work there. To be quite honest, we're pretty rough there, but we're not.
Yeah.
I cut
Yeah.
you off, Dan. We're losing you. All right, so and I know next week we have our next live with Jane and Jody, not necessarily next week, but our next one is actually more focused on traditional Chinese medicine with Dr. Dang. So I know that we're not really addressing acupuncture or Oriental medicine today, and you kind of mentioned that cupping is kind of borrowed from that. But you teach physical manipulation like a chiropractor?
I was taught by my mentor, who was of course a naturopath as well as a chiropractor. And so we practice what's called diversified technique. And so we do exactly what chiropractors do, although we cannot call it adjustments here in our state. We have to call it joint manipulation. It's just something that the chiropractors have lobbied to protect, which is kind of silly, protecting a word. But yeah, we do exactly what chiropractors do, but better. They're pretty good too at joint manipulation, but we incorporate everything else, right? That's the kicker.
Okay, and one last quick question. And I do see there's a lot of good notes here in the thing. You had mentioned right off the bat, like you want to update modalities. You want to make them fresh and new and use this tool instead of that. Or are you actually replacing things, or are you adding new tools? Like, is there something that you've gotten rid of? Like, we don't do that anymore.
There are some antiquated things like diathermy, which is not safe for patients who are pregnant or have cancer. Well, yeah, with cancer as well. I wouldn't treat that. Don't treat anyone with cancer, okay, guys? That'll get you in trouble.
Both of you said no.
Yeah, don't be cutting out cancer either, right, Dr. Rodriguez? Yeah, yeah. We've like, a lot of the older stuff. Like I'm a little bit more new school, and I don't dive towards the nature cure stuff. And if you guys are interested in those things, I do a little bit of it, but but we have hydrotherapy and all that stuff next door at the medical center. But I've formulated a way to treat my patients in a way that if I only had 5 minutes to treat my patients, I want to be very efficacious and efficient. And so I've kind of mastered that, and that took me years to do that. And so I try to, this is just years of practice. So, what we do on our shift, on student rotations is, pretty brutal to our patients, but we get results.
Well,
It hurts so good. Yeah.
that's what I was going to say, Jane.
All right. So thank you so much for sharing and taking me on there. So let's shift over to the pan or the questions, the chat here. So for sure, let's shift the spotlight to Dr. Rodriguez. What is an ND's approach to treating skincare?
To treating skin
Cancer.
That's okay.
Yeah, thank you, Jody.
That's okay.
So it depends. It depends on what type of skin cancer. So Dr. Kwan mentioned not treating cancer and not cutting out cancer. which was a kind of a taboo topic in amongst naturopathic doctors of, what truly are we allowed to treat? I did a lot of preceptorships in dermatology, and I've actually worked with dermatologists that remove cancer, and I have training in doing dermatological surgeries on skin cancer. So provided that you have the training in the state of Arizona, there is nothing written in the law stating that you cannot remove a skin cancer or a lesion that is known to be cancerous. However, depending on how the skin cancer has metastasized, depending on what kind of skin cancer it is, oftentimes it is best to just refer to an oncologist if that's who's going to be continuing care with the patient and who's going to be, if radiation is indicated, if chemotherapy is indicated, again, kind of depending on what type of skin cancer it is. There are board certified naturopathic oncologists known as FABNOs, F-A-B as in boy, N-O. And that is a special board certification. It requires usually postgraduate training and preceptorships, and they have to sit for a board exam in order to become naturopathic oncologists, in which case they usually provide a lot of adjunctive care to patients that are looking for alternatives to allopathic care for their cancer. That ranges from IV therapy, nutritional therapy, it's usually primarily it, but I am trained in removing skin cancers. So it kind of depends. It depends on the type of skin cancer and what I think is going to be best for the patient. I will say that, some patients, some skin cancers are really easy to treat. You cut them out, they go away, they don't come back. And sometimes patients prefer me over their dermatologist. So it does it depends.
Okay. Awesome. So let's see, Dr. Kwan, we have a question for you. Can you speak a bit more about your experience working with professional athletes? I've noticed some professional sports industries have banned a lot of natural treatments for athletes due to some treatments not being FDA regulated. Have you ran into this issue in your work with professional athletes? And if so, how did you work around those restrictions to provide the best care possible for your patients? Good question.
Good question, and also tricky. These players are insured for millions of dollars, and you don't want to just work around something. You don't want to be that doc. And so there's no workaround. It's what's allowed, like what the player is interested in, right? You have to give them informed consent, what possibilities of things that can happen, because that's a great way to lose business, right? Is to have that kind of negative PR that you injured someone, or you did something that was not allowed, or you accidentally gave them something that was on the list of performance enhancing nutrients or drugs. And yeah, now they can't play. Yeah, it's not gonna be cool. So always make sure that you are following rules and regulations, especially for something like that. Now, if you're working with an amateur that doesn't have these regulations, you do what you feel is correct and safe and ethically and morally appropriate. But I would never make those kinds of judgment calls unless you want to risk your license. I mean, you spent years and a lot of money doing this. Is it worth it to give someone some sort of substance that will enhance their, like even testosterone or whatever it might be? You could kill someone, right? So you have to be it'll be tempting to do what you want to do, but make sure you've kind of ruled out all negative possibilities before you do so. I always err on the safe side.
Very good.
Perfect feedback. Absolutely. The next question is also for Dr. Kwan. Could you define physical medicine and review again the range of therapies that fall under physical medicine? I might have already asked that question. It was at 12:25, it's 12:35, but you can hit it again if you want. Based on your response to cupping, then acupuncture falls under physical medicine. You want to address that again?
Well, since I don't do acupuncture, the cupping I do is it does not follow any of the trainings or the teachings of Oriental medicine. And maybe Dr. Rodriguez will be better in talking about the acupuncture and cupping side of things, because it doesn't fall under physical medicine in that sense. The curricula actually utilizes to treat specific AOM type diagnoses. And maybe Dr. Rodriguez can speak on that.
Sure. I mean, I can elaborate a little bit. Acupuncture is kind of considered a completely separate curriculum and training at SCNM. We get, Jane, you might know better than I do, 100 something hours or 80 hours.
You know what? I can look. That's a good point. Okay. Yeah. Let me look at program real fast.
Yeah,
but I know, and go.
So you get several hours. We get lecture, in-person lecture, teaching traditional Chinese medicine diagnosis, in addition to lab where you learn needling technique. We get several hours of acupuncture training since in the state of Arizona, acupuncture falls under our license. In most other states, you need an additional LAC, so license to do acupuncture. But in Arizona, it falls under the naturopathic scope of practice, and it's actually part of our boards, our NPLEX, the part 2, the step 2 boards that we take. It's a selective, and so it's a whole other part of your license.
It's broken out in OMND courses on our program of study. And the great news is again, our next live with Jane and Jody is with Dr. Dang. So we're really going to go in very specifically into not just acupuncture, but the whole scope of Oriental medicine.
Yeah, exactly.
Yeah, great questions, you guys. This engagement is fantastic. Really appreciate it. So for both Dr. Rodriguez and Dr. Kwan, can you walk us through how you both became established after graduating and completing residency? Ooh, and I was curious, what's the difference in preceptor and residency, if that's relevant? How did you expand your clientele, maintain retention, and continue educational studies to have more variety in your practice too? We'll start with Dr. Kwan.
Ooh, that's sounds like a loaded question. Everyone's experience is so different. I was just fortunate to have a really good mentor. So my recommendation for any business that you run or participate in, always have a mentor, someone that's done it already, right? You can make stuff up, but someone that's tried things, so find a doc, find a someone that's retired, whatever, just pick their brain. I think that's gonna be the best information. Like even reading books, right? Someone in the world has already done exactly what you've done or trying to do. Why not learn from them? That's from these individuals, these books, these mentors who've already done it. None of this is new. So aside from that, wow, that's a long question. I did residency, and so that helped. In Washington, we naturopaths are actually recognized by major insurance companies. So I got a lot of my patients from there. So you guys are, if you guys work really hard and create a name for yourself, work really hard, and just be diligent, you can make a 6-figure income easy. It just takes a lot of work, and do a lot of self-work too. That's what I'm learning these past couple of years. Is like, if you are always down in the dumps about yourself, you're not going to get anywhere. You gotta love yourself, or you're not going to go anywhere in life. And so this is all stuff that I've learned. Like, it doesn't sound like, whoa, this is so newfandangled. It's like, no, really, you guys really gotta love yourselves, or you're not going to be successful at all. Patient retention, just be nice people. Be honest, don't just gouge your patients for money. A lot of Arizona, I noticed people are just here to just gouge their patients. Be careful. And then I obviously teach, so I also teach kinesiotherapy. I have a lot of side gigs too, right? Like teaching is a passion, but gotta make money too, right? So I have some side gigs that I do as well. And so just be nice people. People will flock to you. Word of mouth is the way to keep. I think word of mouth is the best way to do it. If you can figure out how to do social media, by all means, that's also great too. I don't know how to do that.
Good feedback. Thanks again for sharing. Dr. Rodriguez, I would love to hear from you as well. I don't know if you can see the chat because that was a long question, or would you like me to repeat it?
I can take a look. Can you walk us through how to establish after graduating with residency? very similar answer to what Dr. Kwan said. During residency, I kind of developed my passion for teaching, and I kind of created a niche for myself of minor surgery and dermatology is not everyone does it. And so kind of creating that niche for myself and developing my expertise. I had some good mentors that helped me kind of develop my expertise in it. And word of mouth is really big. I have a lot of student patients. Your skin does weird stuff during medical school and during time of stress. And so I end up having a lot of students kind of come seek me out. And so that keeps me busy. And then they, the students, their skin gets better, and then they tell their friends about it, or they tell their parents about it. And word of mouth is a big one. I also have yet to figure out social media. I have a lot of people that are like, you're like pimple popper. Can't we put you on YouTube? You need a TikTok account. I was like, I don't know. Sure. Dr. Kwan and I are just missed that we're older in the sense that it's like, yeah, less sure.
That's
yeah.
funny. So let me ask this before,
Really good.
especially before Dr. Rodriguez leaves. So where in the program, let's talk a little bit about the learning aspect. When is minor surgery offered? And do you know how many credits a student's going to be taking in minor surgery?
I believe it's 4 total credits. There are 2 minor surgery courses. The first minor surgery course happens quarter 10, and that's taught by someone else. Minor surgery 2 happens quarter 13. So they kind of get a little bit of time to practice in clinic. And then quarter 13 is minor surgery 2. Both have a lecture and a lab component to it. Yeah, is it quarter 12 or 13? It may be quarter 12.
Okay.
I forget. It may be quarter 12, either quarter 12 or 13, but there's definitely a couple of quarters in between minor surgery 1 and minor surgery 2. But I've actually heard that is different from other programs. Other programs at other schools, they only do 1 offering of minor surgery, and I've heard that makes the board exams very difficult.
Where you at here, Jane? Minor surgery right there. That's quarter 11.
Okay.
Minor surgery 1.
So it's probably 11 and 13 then.
11 and 13. Okay.
Right. Well, you mentioned quarter 10. So here's quarter 10 is minor surgery 1.
Okay.
In the lab.
I was thinking that was
MSRG.
quarter 11. Okay.
I think that's quarter 10 right there.
Yeah.
And then you mentioned, let's say we're looking for MSRG a little bit further on.
13,
MSRG, right,
Yeah.
right there.
Okay.
Actually, what I'm going to do, everybody, is put a link to this right in the chat.
Awesome. I have another question in there for Dr. Rodriguez-Sleeves. How would you both recommend dealing with the stress of medical school and having a good balance with school and free time?
It's important to find a way. For me, it became really important to, when I was at school doing my school things. There were times when I would have to, study at home. But I really tried to, when I was at home, I'm at home. When I'm at school, I'm at school. So usually I would try to not study at home. If I was going to be studying, I go to a coffee shop or one of the study spaces at school in order to kind of have that balance. I also worked the entire time that I was in medical school, which I don't know that works for everybody. But for me, it made me a more efficient studier. It was like, instead of having all day to study for Gen Med, I had like this 3-hour time. And if I didn't study during that 3-hour time, then, I wasn't going to do well, versus having all day. There's time to, I'll study after I eat breakfast and clean the kitchen and get on social media for a little bit, or after I watch the show. So it made me a little bit more efficient to work while I was in school, but I know that doesn't work for everyone. But using your social circles, using your support system, be friends with people at school, plan things together outside of school, stay on top of your physical health, on top of your mental, in addition to your mental, emotional health. Find ways to exercise and eat right, because everything does get a little bit harder and more stressful in medical school. So at least try to keep some things in line.
You are a mom, so I have to ask, did you start your family before, during, or after SCNM?
It was a little bit of a mix. So my husband and I started dating when I was in school, I think during my second-ish year, and he had twin boys that were 2 years old at the time. And we started living together. And so that's how I got my twins. And then I had my youngest just after residency. So had kids during school, and then like acquired kids during school. But it's definitely the challenge to strike that work-life balance for sure.
Thank you for sharing. Mm-hmm.
I believe this silence means I should be speaking. Okay. I would have to agree with everything that Dr. Rodriguez said. I don't have kids, but I believe I have some sort of like version of ADHD. And no matter what I try to do, I always try to do too much. And I was working too. I was working. That's craziness. I got a dog in my second year of school. What the heck was I doing? And then you have personal life and dating and stuff. Gosh, what a poop show. But you know, a lot of it is like, I think you find out how you learn, find out how you are successful, because I know I'm a crappy student and look at where I'm sitting now. I'm just joking, but I was a really bad student and I studied like last minute all-nighters. Like that's just how it was. I just rolled with that kind of like stress. Not good for you guys though. I would try to plan it out better. In looking back, I should have done that, but I was a goofball. Like I was not academically like doing, like I was not that person that gets straight A's, right? And so you don't have to be, but you know, think about what motivates you. You know, why are you doing this? You know, if you don't study, you're not going to be a good doctor. And it really comes down to that. And, you know, find your passion, but also put in the work. It's hard. This is not an easy program. And I believe SCNM seems harder than past year for some reason. Maybe it's just like, I just can't imagine being med school again. I have no idea, but it's pretty rough. And so you're going to be your emotions, your personal life, your everything is going to be put to the test. And if you don't have the grit or, you know, the stomach for it, like you need to reevaluate your life and find out what your priorities are. Because this isn't a joke, right? This is not going to undergrad. This is med school. Even if it's not, it's still med school. It doesn't matter if it's MD med school, DO, nurse practitioner, PA. It's people's lives at stake here. So, just I don't know what else to say that Dr. Rodriguez didn't say. But yeah, you just got to be efficient, know yourself. And I'm a big fan of knowing yourself and knowing what you need. And then asking your docs, asking your professors, like how do you improve, get tutoring, work with your friends, get into nature. Seattle, we had freaking like awesome hikes out there. You know, the school was in a freaking state park. Like I would mountain bike in there all the time. It was great. So find your activities, find your passions. Yeah.
Dr. Kwan, can I ask you, what made you want to do a residency?
I actually didn't want to. I wanted to work with my mentor.
Okay.
But my mentor was going to work with the Mariners at the time. And so he's like, do the residency. I was like, all right. So I did it. And I got in. It was great.
Okay.
Yeah.
Okay. But it wasn't your first choice.
But residency is important. I wish there was a residency for everyone. And when you're talking about medicine, it's called a practice for a reason. You have to practice, you have to see patients. Residencies will afford you that. They'll afford you patient contacts and continued, like not supervision, but you have your mentors there. And so residency, I would say fight tooth and nail for that spot. Fight, like this is where friends become enemies. I'm just joking, but you guys need to get that residency regardless, or find a doc that you can work with that you can see a lot of patients. That's all it really is numbers game. Get your numbers up.
Both of you
All
talk
the
a lot about a
fun time.
mentor. Yeah, mentor. That's what I think of when I hear residency or preceptor.
Right,
All,
right.
yeah, all of those things, as much as you can be connected.
I do have to
And-
go. I have to teach now. So
Oh my
I think
gosh.
nice to meet you all. I'm reaching
Amazing.
reach out if you guys have any questions.
Okay.
Will do.
Thank you,
Yeah.
Dr.
You guys.
Thank you so much, Dr. Kwan. Have a great afternoon. All right, everybody. Thank you so much. I mean, that was excellent. That's what we always want to have every week, is that engagement from you guys, your questions and information. If for some reason we didn't get your question here, we'll send a follow-up email to the doctors and ask for a little bit more feedback and make sure we get that out to you guys. I think it was kind of neat to put the connection together myself, because I also was thinking that under the Chinese medicine and physical manipulation, I felt like those were somehow connected and entwined, that they were almost one and the same. But I'm
Right.
pretty excited that we have Dr. Dang coming in.
Yeah, it kind of fit right in, didn't it?
Yeah.
You know, like, yeah.
Nice.
Amazing.
All right.
So yeah, I don't think, Keita, you guys